Again, we have, if you would like to receive CEUs for this section, please click the link provided or scan the QR code. This information will be available at the end of the presentation. So our final presentation for today is Dr. Hilary Hewes, Professor of Pediatrics, University of Utah Primary Children's Hospital, and she is a community engagement domain co-lead. Thank you for doing that for us, Hilary. Let's welcome here Dr. Hewes.
Hey everyone, thanks so much for letting me talk today. I know I'm the last to go and it's always hard to be the last one, but my time will probably not take up all the time needed. So we will aim on getting everyone out of here on time, if not a little bit early. I'm going to talk a little bit about outreach, engagement, and collaboration with primary non-English speakers. And I will upfront tell you guys, I am not an expert in this subject. I am guessing multiple of you here on this call know more about this than I do. I do engage in this work frequently as I do speak Spanish. And so I often am called upon to give some information in Spanish, but I by no means am multilingual. I'm guessing many of you are. And so please, I really would love this to be interactive. Please throw out your own experience and advice as we go along. Next slide, please. So our objectives are going to be to discuss some strategies to effectively communicate and collaborate with primarily non-English speaking families and community members. And then we're going to look at some mapping tools to better understand how you can figure out what your community and language needs are around you guys. And I purposely did not put any interactive maps in here. These are all interactive when you go live online to them, but I've had a lot of bad experiences where you try to pull up interactive maps during a talk and it doesn't go well. So there's links on the bottom of each slide to show you guys these things, but I didn't want to waste your time with my technology failing. Next slide, please. I don't have any financial disclosures. Next slide, please. So in background, there's more than 300 languages spoken routinely in the United States every day, and an estimated 21% of the population speaks a language other than English in the home. And my guess is that's higher. That's probably just some of the folks who tend to speak English or a language other than English most routinely, but I think a lot of families have a big mix of languages spoken in their home. Next slide, please. So we're going to talk about a couple different strategies to figure out how do we target the non-English speaking population and what are some effective measures to do so. So number one, we can't do anything without knowing your target population and knowing what languages are prevalent in your region. So like everything else, it starts with figuring out what are my objectives? What am I hoping to do with my project? Who am I hoping to reach the information with? And then starting to research, now I got to figure out who do I target? And there's a couple different ways to accomplish this. Next slide, please. So I would start with some research into the cultural groups and languages spoken in the areas. And language is hard because we know, I'm going to use Spanish. That's the language I'm most familiar with other than English, but there's Spanish spoken in Puerto Rico, there's Spanish spoken in Chile, there's Spanish spoken in Spain, Mexico. These are that even though they're all considered Spanish, if anyone has listened to a Puerto Rican speak versus someone from Mexico speak, the language is very different. And language is culture and language is history, and we have to acknowledge that. So I do think, unfortunately, when we talk about language, we are limited a little bit in that it is this big umbrella. Same thing with things like Arabic. You know, culture is different in different areas, even if the same umbrella language is spoken. But even though we're limited, I still think there's a lot of value in outreach in native languages for people because it does acknowledge the value of that culture and it acknowledges the history of that culture. And so I think it's really important to do the research and figure out what languages are prevalent in your area. And then language also incorporates more than just, again, one population of people. We also have to think about how do we reach folks of different age, different gender, different socioeconomic status. There's probably going to be messages that are different and similar between all of those factors. We definitely want to consult with local leaders and community organizations and bilingual workers to help us figure out some of these answers. Next slide, please. So we're going to go into a couple of these maps. I know you heard about the mapping project that the UAB team has done earlier. Some of these new resources we have with things like Tableau just make maps amazing. I think they're really, really fun to play with. This is from languagemap.us. You can kind of see there on the bottom. So what I did when I went into this, first you have to decide what population I'm talking about. So I live in Utah. So I pulled up the United States map And here is just across the United States, the most common languages. And you can see those percentiles. The darker the color, the higher percentile of a different language, other than English being spoken in the home. Next slide, please. And then you can focus down into more. I was thinking, okay, if I'm just talking about the state of Utah, what am I talking about? So you can click on the area you're interested in, and this brings up the top 5 languages spoken in your area. I'm always surprised when I look into Utah that things like German pop up as one of our most common languages. They estimate that about 300,000 people in Utah speak a language other than English in the home, which is about 10% of our overall population. But that's probably not enough. When you're talking about targeting a population, you really need to get a little bit deeper. So if we go to the next slide, all of these maps allow you to get even deeper, kind of more granular. This is by our counties and even by our cities. So Salt Lake City is our largest population area, but really it incorporates things like West Valley City that you can see on there, Taylorsville, West Jordan, Sandy, Draper. These are all part of the Salt Lake County area, but you can see big differences in what population spread is across this area. And this is focusing on Spanish. So these are percentage of Spanish speakers across the different areas here in the Salt Lake County area. So this is one of those map tools that I think is really interesting. So if you're thinking, okay, I'm going to focus my efforts on improving school readiness or improving vaccination information in Salt Lake County, I'm going to pull up the most common languages. I'm going to go target West Valley City is one of my areas where Spanish is routinely spoken, and I'm going to make sure I have good information in Spanish for that population. Next slide, please. And please interrupt me at any time. I just put a couple examples of these maps in because I think some of them are just really fun. This one is really pretty. I would like to put this on my wall because I think it's just kind of a cool visualization. You can see this is the link down there for the language map. This one looks, so some of the big circles represent educational institutions, mostly universities and community colleges, but you can still get more granular around the circles into the actual communities themselves. So you can see on that right side there, they give you lots of different check boxes where you can kind of choose what you're thinking of, what language you want to target, or you want to look at, if you really do want to look at higher education, you can talk about undergraduates and graduates, but you can still get into the community across that. Or if you're thinking, hey, I want to target some young adults, I want to get out into our community colleges and see what languages are being spoken and our mix of population there, it's a great tool. Next slide, please. But again, if you narrow into the Utah area, Salt Lake is in that, is kind of right by the blue line there. The blue kind of teardrop shaped thing is over Park City or Summit County, which is pretty close to Salt Lake. And you can see it's still, even though there's not a upper or a graduate or undergraduate institution in Summit County, it still gives you a mix of the languages, an estimate of the count of speakers and percentage of speakers who speak those languages. Next slide, please. And then our Census Bureau has a lot of great information. Next slide, please. So again, you can enter things like, I chose Alabama because of my Alabama friends on this one. You can enter your state, your county. It will give you a percentage of those who identify as speaking English less than very well in the home. And again, as you target in, it'll give you more information. Next slide. Okay, so before we move on to the next strategy, any question on maps? There are multiple other ways. Most of us are very familiar with what languages are spoken. You could, if you work within a healthcare system, you could ask your IT team to, run a query on your patient population to figure out the most common languages that are identified when people are registering for healthcare services. Your local health department likely has some of this information. Anyone recently do an outreach campaign to non-English speakers and have any tools they'd like to share? It's okay. We'll keep going. You guys speak up anytime or throw something in the chat, okay? So strategy 2. So now you say, okay, I'm going to focus, for me, a big focus of my efforts are on our Spanish-speaking population, especially in our West Valley area. But how do I get that information to my audience? I can sit there and think all day about what I want to say and why I think that's important. But how do I get that information to the audience? How do I make sure it's relevant? What are important considerations on how to reach our target population and how to prepare that material to be shared? So next slide, please. So things that are really important, and I know some of this has been covered in previous presentations. I think a lot of these themes have kind of been repeated, but we need to think about ways to disseminate information. That's going to be very uh, dependent on your population you're seeking to get the information to. If you're aiming for 65 and older, that's going to be different methods than if you're aiming for the under 18 crowd. There'll be some crossover, but obviously there's going to be different preferences among age groups and even between gender and socioeconomic status. The use of appropriate language and imagery is very important. It's something we talk about a lot about together here in our community engagement domain. Representation is important, and how that representation is presented is important. So whenever you're making any sort of visual flyer or a YouTube video, whatever it may be, it's really important that we're using feedback from members of that community to make sure that we are appropriately representing the community and in no way being harmful or disrespectful. We also want to make sure that we are using accurate words and there's cultural relevance. Again, this is tricky when you talk about a language like Spanish. You could write something in textbook Spanish, but someone from one country is going to probably use a little bit different words or jargon than someone from another country. And then cultural relevance. We don't want to be using pictures or graphics or something from 1960 that are no longer relevant. One thing that I think is important is if we are translating things, still making things available in the original language. That can sometimes help just, if there are multilingual speakers in the home and there's, a question on a word, there's two different sources there. And then using cultural interpretation rather than literal translation. And that's where having those native speakers really look at something and making sure that we're not just translating word for word. We're not using Google Translate. We're using some cultural interpretation with our information is important. I think there might be a comment.
It says it's not really a question, but she asked for resources that have been helpful as of late. I work with Cooper Green a lot, and we partner with Hispanic radio stations. People will listen to radio, they're empowered to get more information because it's a radio station and individuals they trust.
Absolutely. So trust is a big thing. I know we've mentioned that a lot throughout the day. Again, I think the first step towards trust is taking the time and effort to speak someone's language, even if you aren't a very competent speaker, even if you're invited as a group to an event and you're there and you are the least competent speaker in that language, learn a couple words. Even showing a little effort shows value. Again, value and respect for that culture, that language, that community. So I think that's really important. So I think that's the first step towards trust. And then using native speakers when possible, using those pictures, graphics, images that are culturally relevant and culturally appropriate, I think is really important. Before I joined the Pediatric Pandemic Network, I've learned so much in the last several years from this group, and I hadn't thought a ton about when I walked down the hallways of our hospital. We are a very dominant white state, but I was looking at some of the pictures, and man, it was not very. There was not a lot of variety on some of the pictures in our hospital, and that has gotten better. And there was not a lot of representation of children and youth with special care needs. That has gotten a lot better. And so I do think there's a growing understanding of the need, again, for representation, how important that is in every sphere of life, not just healthcare. So I think that's another way to build trust. But I think working, as most of our speakers have said today, working with groups that know their community, religious organizations are a huge one for that. Things like our YMCAs, schools, you can't get any better than schools. That is a trusted source for a lot of family members. They trust the teachers. They know that's a safe place for their kids. I think those are all really good examples of ways to go out into the community, find members who are already trusted, and then build on that trust. We can go to the next slide. All right, so when we are talking about getting information to our audience, health literacy is important. Our goal is usually to aim for like a 2nd to 5th grade reading level. We know that a lot of different populations across the United States, there's variation in reading level, and so we want to make sure information is understandable. Another thing that's really hard, I do it every day, and I have to catch myself, is avoiding idioms and jargon and slang. we don't even think about it. And sometimes we don't even think that some of the things we say, the cultural context and the historical context of what we say can be offensive. And so trying to avoid any idioms and jargon and slang is really important, especially when we're putting out printed materials. And then keeping language as simple as possible to get the point across. This is something else I think we're not great at. And sometimes we're trying to just be polite and be, as kind as possible, but it makes things more difficult. So instead of saying something like, if you don't mind, would it be possible for you to reschedule for a time next week? That's a lot of words and that's a lot of big words. And it's kind of a roundabout way to say something. You can say, I'm busy this week. Do you have time next week? So being very direct and efficient in language is important, especially when you're with a primarily non-English speaking community and population. Any questions on that? All right, next slide, please. All right, so I'm going to throw this out. Sarah just mentioned some of the projects they're doing. What are some strategies people here in the audience have used to get information out to a wide audience, including some of the primary non-English speaking families in your community? What have you guys utilized in the past?
People have used radio as suggested by one of the panelists. I think people have tried to use like billboards within the hospital and even on the highway in language that people utilize. I think particularly with individuals who are of Latin descent, churches have been used a lot to try to help disseminate information, and certainly schools as well.
Thank you. Community events is a great one. I can't stress that enough because that's also FaceTime. We can talk on the radio, we can put things on YouTube, but actually speaking face to face with people is so important. And again, even if you're not a other language speaker, just learning a few words, just thanking them in the language that you're hoping to target makes a big difference. All right, next slide, please. So you guys mentioned a lot of these. There's tons of ways to disseminate information. Some of this is going to depend on your target audience. I don't know a lot of teenagers my daughter's age who listen to the radio. They all have their playlists and they just listen to their playlists. But I do know a lot of people in the age of 30 to 60 who listen to the radio. Not a lot of young people pick up a newspaper anymore, but other people do. Community organizations, you guys mentioned religious organizations, schools and daycares, and then obviously we believe in involving youth, as oftentimes youth, especially in non-English speaking families, are the voice for their family. They might be the folks that are the most fluent in English, and they might be the ones who are bringing information to and from the household. Next slide, please. So when we talk about getting out things on social media has become more and more powerful. It's probably the most used method now to get information out. Some important things that I think we need to keep in mind when using social media are listed here. And you can see where I got this content from down below, but be cautious of translation tools. We kind of talked about this. We don't want to just rely on things like Google Translate. We really need someone who has an understanding of both languages and cultures to look at the translation, make sure it is appropriate and relevant. Things like learning those basic phrases, engaging in multilingual content. A lot of non-English speakers do use a mix of English and another language. And so maybe even including a mix on that content. Visual communication is so important. So maybe minimizing words, using more visuals. We know in medicine, a picture can mean 1,000 words, like showing a picture of a syringe and how much to fill it for a parent is a lot better than telling them to give a child 3.5 milliliters. So visualization is really important. Using those native speakers and then being mindful of cultural differences. So even on social media, which sometimes can seem a little relaxed and a little bit, just quick, we still need to be very thoughtful in how we're presenting that material. Next slide, please. So again, we got to do our research too. So how are we going to get this information out? It depends on who you're targeting, but we have great people who do research into this. So the Pew Research Institute or the Pew Research Center hopefully will remain funded is one that's done a ton of research on this topic. And I focused on Latino adults. Again, there's some information about other languages coming up here, but you can see here that most Latino adults prefer social media as a source. news and websites or apps is kind of second. They'll search for information. So making sure that you're working with someone who is good at that systems optimization, getting your information up high on a Google search, podcast, television, radio, and print. We talked about someone brought up the idea of radio. Radio is powerful, but we need to make sure we're linking it to other things. So if you're doing a radio presentation, also pair it with a tweet or pair it with a Facebook announcement or whatever it may be. I think making sure that we're not using any of these in isolation is really important. And then they asked people in Spain what were the most common apps they used to get, or most common routes of social media they use to get their information. And you can see that Facebook still dominates. Things like Instagram, Meta are also in there as well. But these are kind of themes that you can see across the world. They seem to be the most common social media platforms. Next slide, please. And then again, the Pew Research Institute provided both of these graphs, but they looked at the way US Hispanic population news, what kind of consumption of news they get across different platforms, and found it's pretty similar across 4 major ethnic groups. Maybe Asian population prefers digital devices a little bit more. They on this found that perhaps the Black population prefers television, but really it's pretty evenly spread. And so again, I think when we're thinking about getting information out, it would be interesting to see the age breakdown on all of these, but I think we do have to always think about multimedia and not just picking one way to get this out. And then thinking about, how do we, again, target certain populations? I thought this was interesting that 5 states are home to about half of all Arabic speakers. So if you live in one of these states thinking, gosh, I have a huge responsibility towards our Arabic speaking population. If you don't live in one of those 5 states thinking, how am I going to get this information out? This is still a big, important population, using those maps to target down to that area. Next slide, please. So a lot of us are in the healthcare world. Hopefully you've gotten training about interacting with families who are not primarily non-English speaking in the past, but things that are really important. And I just wanted to include this slide, even though this is on community engagement, all of us do daily engagement with healthcare. So making sure we're speaking directly to the patient, even when using an interpreter. We want to have eye contact with the patient. They are our responsibility, not the interpreter. Making sure we're documenting language preferences and health records. Again, using that simple jargon-free language, trying to ensure that we have educational material in the patient's preferred languages is really hard when there are 300 different languages in the United States, but as much as possible, if you can't, using some of these things like these visual representations to help communicate is helpful. And then avoiding those unconscious bias and cultural assumptions. And then this one is tricky, and we're often faced with this in the emergency department. A family member is brought in to interpret, and we really would like to avoid that when possible. That puts that family member in an uncomfortable spot, and especially if that family member is a minor and they're the one they're seeking care, they might choose what they tell their parent, or they might paint things in a different light than what their parent is hoping. So always trying to get an interpreter, at least over the phone, if not possible in person. Next slide, please. Okay, so I was trying to keep this pretty short and sweet. Our conclusions are we want to make sure that we have access of primary non-English speaking families to reliable information. It's a critical aspect of community engagement. To do this, we have to make sure you know your community and the language spoken, the language that are spoken there. We have to work with trusted and various sources to disseminate information in other languages, and in doing so, keep our language really simple and concise. Next slide, please. I'm a cat lover, so I thought this was funny. I like to end on a little humor, but I would love to hear some personal experiences. I saw a couple messages flashing up on the chat, and I'm sorry I couldn't look at the chat while I was doing so, but let me see if I can pull it up now. And I'd love to hear people's stories and successes.
One is from Jill McCormick. If the community uses pictures as a way of communicating, look at more pictures, less words.
Absolutely. And I think that's true across the board. You can't work a day in any field without coming across folks of a huge variety of healthcare literacy and literacy in general. And so I think pictures, for me, I'm a visual person. I would much rather look at a picture than read even an abstract. At this point, my attention span has changed as I've gotten older. So I think pictures are very important. I think they're powerful, and I think they should be incorporated into any community engagement efforts.
there's a comment, percent youth get their news from TikTok is estimated to be 40%. So
Yeah,
yes.
so the under 18 as a whole, and youth, we can define youth in a lot of different ways. We all know that youth are still 25-year-olds, but especially the under 18s, TikTok is enormous. And so again, if you're hoping to get information out, we can use TV, we can use radio, we can use print, but that youth is oftentimes the voice for that family, especially recently immigrated or relocated families from other countries. The youth tend to be the voice for that family. They tend to be the ones who are out in the public sphere the most. And so if we want information to be trickled down into the household, we really have to make sure we're paying attention to what the youth is paying attention to. So TikTok, Facebook, Instagram, all of those apps are really important.
Another comment, how about text messaging?
Text is tricky. So I might defer to some of you guys who do a lot more with adolescents. So if I know there are ways that you can opt in to get text messages. I know that with youth under 18, or there's certain ages we have to get permission to send texts. I always hesitate a little bit, like, in the world of things like youth sports, I've had coaches be very direct saying, I will never text your child individually. I always link it to a text to you. I think there is important privacy and protection things that need to be in place with texts, but I do think there's a place for it. And especially as our youth become in approaching that adult age, so the 16, 17, 18-year-olds who are starting to become more independent and prepare to perhaps leave the household and be in charge of their own health and life a little bit more, ensuring that they are getting that messaging directly is really important. But Tamara, others who work a lot with youth, and Sarah, you do a lot of adolescent medicine as well. What would you guys think in terms of text?
Yeah, I thank you for sharing that with us as well. I think it really depends on what the matter is. So if it's communicating health information, I would never send a text because I would be concerned that not only would it potentially be intercepted, but it also could become part of a transcript from your provider, so Verizon or whomever. So I generally don't send text messages, but an example when we do is just as you alluded to. So when we do our youth advisory board meetings, we send group text messages, but that is going to a group. And so it doesn't have the kind of same meaning. And it's not about anything that would be HIPAA related or personal or confidential, but anything that's personal or confidential or protected by HIPAA, I would not, or minors consent laws, I would not text. And then the other thing about texting, particularly if you are dealing with non-English speakers, is I'm not equipped to text in many different languages. So it clearly has some barriers as it relates to text in various alphabets.
We definitely use texting like one way, like message push texting with permission, particularly with specific programs or under research protocols where the recipients have agreed to receive it and know that there's not going to be a closed loop back to the origin of the message. But it has been helpful for pushing out surveys, getting feedback on projects where the text is a link to a web-based survey or something like that.
We have a couple of questions. What are ways to identify community leaders of non-English speaking populations in your area? And how would you approach reaching out to those leaders?
Yeah, so that's definitely a challenge, especially if you aren't readily involved in some of the communities. But I think sometimes it's as easy as an internet search. And so say I'm interested in meeting some of, we have a pretty large Somali population here in Utah. So I might search for, Somali church events or, community events, and maybe you can find a contact information there, or they have a lot of like refugee nights. We have things like the International Refugee Committee or Rescue Committee that would be a good reference, or at least maybe able to point you in the right direction. I think all of those are good sources. And then I don't think we can overestimate how important our pediatricians and family medicine physicians are. So if we're going to some of our clinics, hopefully we all know kind of in our community what clinics serve a lot of our refugee and immigrant populations, going to those clinics and saying, hey, who do you feel like is a good leader in this community? It seems like a lot of the times it's pretty easy to find on a search. Like I found a lot of our Pacific Island leaders on Google searches. So I think that's one way to do it. But everyone else throughout ideas that you guys have used in the past that have been successful.
What are some ways to use social media to get information out and build an audience with primary non-English speaking families?
Yeah, so I think number one is figuring out what your message is. What are you trying to get out? Making sure that you've had someone look at your content and what you want to send out and look it over for cultural relevance and translation. And then I think that you have to start building those nets between things. So say you join the Catholic Community Charity, Catholic Community Services. That's a huge group that works with a lot of our Latino population. And then you look through their page on Facebook or Instagram and you start seeing tags to other things. And then you like that thing and you like this thing. And it takes time and it takes effort. Everyone thinks social media is pretty easy and you just put up a post, but there's actually a lot more to it. And there's people who really specialize in this. And it's great to work with some of those folks because they understand how you build that network. So it's not just putting up a post, because if no one knows you, no one's going to look at that post. So it's going into some of these other already existing communities that have a good amount of influence and a good lot of followers and starting to follow their posts and like their posts and then building that web so that when you post something now, you have that interactive kind of presence on social media. But I'm not a social media expert. There are definitely people who do this as a career and understand this a lot better than I do. But I think that's one way to do it. Or hooking it up, joining it, like someone mentioned school boards, schools, linking it to schools if you can get permission to link it to a school page. Some of the clinics out there will put up information. The public health in your community, in your county or state is a good way as well.
Well, thank you, Dr. Hughes, for sharing practical strategies and thoughtful approaches for engaging families with non-English language purposes. This knowledge is essential for equitable and effective care. We thank you so much. And I like your cat because I have cats. Thank you.
Well, thank you so much, you guys. I hope everyone has had a good day and I appreciate it. Let me talk.
Yeah, thank you.